hospitals. Why does government run RTC buses? I mean, I want every intelligent person to slightly give a thought on this. See, if government were to not do these things, if government were to not run these hospitals, if government were to not run these schools, if government were to not run the RTC buses, then private exploitation cannot be stopped. In order to put a check to private exploitation, governments throughout the country take it upon their shoulders to actually run these government schools, these government hospitals, these government RTC buses. Only then private exploitation would come to a halt. See, what one medical college would do, currently this caters to around 7 constituencies. Every district made into, every 7 constituencies carved out into one particular, every parliament carved out into one particular district. What this does is, this medical college would be a college where the poor would get a multi-speciality hospital available to them, where treatment would be done free of cost. Not only that, not only would the patients be entitled for treatment in in these teaching hospitals free of cost, but also in these 7 assembly segments, private exploitation would come to a halt because of this medical college, this teaching hospital, which is a super speciality hospital, which also comes into existence. The staff who's working there in these medical colleges, the assistant professors, the professors, the PG students, the nursing students, the medicos, all these people would be deployed in these hospitals, wherein super speciality and multi-speciality services would be available free of cost to the patients pertaining to these particular 7-8 assembly segments. Not only this, the medical seats which are going to be available, which are going to be coming out of these medical colleges also, 50% of them would be available to them at a throwaway rates of 15,000 rupees per seat. Second, the balance 50% to make it a self-sustaining model, what we had conceived, even these medical seats also would be available to any child at much less than what the private educational institutions would be charging.